I began this morning by saying the right questions for all of us about how we behave when the lockdown ends are the crucial ones. It's not just ministers, it's the rest of us thinking about how we're going to travel and all of that. A lot of those questions are, of course, about transport, the daily commute to holidays, and I'm joined now by Grant Shapps, the Transport Secretary. Before we come on to transport, if I may, Grant Shapps, let me ask you something that puzzles a lot of people. The government says it's taken the right decisions at the right time, and above all, you've been trying to avoid the NHS going under by asking people to take some really tough decisions. By and large, we as a country have behaved ourselves properly. The NHS has coped with this. And yet, we have a very, very high death rate. Why do you think that is?
Well, first of all, I mean, anyone who has died, I know a number of people now, or knew a number of people, is a huge tragedy, and our heart goes out to all of them and their families. I thought actually your interview with Sir Ian Diamond, the statistician, was very interesting, as he cautioned against making these international comparisons for all the reasons that he was explaining. And
I'm not making an international
no,
comparison.
No, sure.
I'm just saying it's a very
you asked me the same
raw
question
big number.
as you ask him, and I take my lead from people like statisticians like Sir Ian Diamond. There's very interesting, for those who want to sort of look into this more, article I read in The Guardian, I think it was on Thursday, by Professor David Spiegel-Halter, who goes in detail to the reasons, but it was, he says, indeed a factor of having to look at the excess mortalities over a period of time rather than what's happening in the instant, because there may be an awful lot of other demographics and so on and so forth involved.
I'm still sort of confused as to why we've had such a high death rate. That's really the question, isn't it?
Yeah, it is. But I mean, I'm not to be evasive at all, as the scientists are saying, and indeed, Sir Ian Diamond you interviewed. I think we'll have to judge that in the longer run. It is, I imagine, a factor of the things that he was talking about, things like density of population. If you look at somewhere like France, although they've also had, sadly, similarly high figures, we have much denser cities, for example. It may also be a product of, we have excellent statisticians, the Office of National Statistics, for example, counting perhaps in a way that other countries don't. So I think it is the case, I think I'm right in saying it's the case that outside of a hospital, if you are tested and are positive for COVID, even if that's not the reason of death, that would be counted.
But not in some other countries.
Not in some
I mean,
other countries.
one of the things that people have talked about a lot, we've talked about on the programme a lot, is what is going on in care homes at the moment, because it does seem that people were transferred from hospitals into care homes to release pressure on hospitals, but without being tested first. So they were, in effect, carrying the COVID-19 into places where there were lots and lots of vulnerable people. For instance, Professor Keith Willett, who's NHS England's COVID-19 director, said, the expectation, therefore, is that in the next few weeks, care homes will be the epicentres of transmission back into society. There is something really serious happening in care homes.
Well, I hope that won't be the case. And by the way, I think it's absolutely right that all of these issues are properly looked into at the right time. I hope that won't be the case, that final prediction, simply for the fact that infections in care homes are now falling rather than rising, and everybody in a care home, whether that's a patient or indeed a member of staff, can be tested, and they can be tested whether they are symptomatic or even asymptomatic. So that's now available because we've got this big expansion in test capacity.
If we'd been doing this a little bit earlier, a lot of people might not have died.
Yes, if we had had 100,000 test capacity before this thing started, and the knowledge that we now have retrospectively, I'm sure many things could be different. The fact of the matter is, this is not a country that had, although we're very big in pharmaceuticals as a country, we're not a country that had very large test capacity as been covered.
But we should have done, unlike Germany. Germany has, and we should have done that.
Germany happened to have an industrial base in test capacity. We happen to have, in pharmaceuticals, an industrial base through the likes of AstraZeneca and GSK in pharma products. You can't help where you start on these things, but we have ramped that up very significantly so that coming out of this first wave and now on the downward trend, we will be able to extend those tests to many more people.
It might also be because of the lack of personal protective equipment for people in care homes. Care England's chief executive, Professor Martin Green, says we're a long way behind because despite what the Health Secretary says about us being always regarded as a priority, clearly we weren't. We had PPE supplies disrupted and primary care completely withdrawing from care homes. We looked away from care homes as a country at the wrong moment, didn't we?
Again, I think, when you look at care homes, most care homes would have previously, prior to this, most are private, and most will have been purchasing their PPE privately. Obviously, the state, the government, the army has stepped in, and as has been said many times, there are now over 1 billion pieces delivered, with millions of pieces being delivered every day to the whole health and social care sector. So it is a fact, and I think it's worth just stressing that this is a global problem. I saw on reported these German protests by doctors outside the German Bundestag for, guess what, lack of PPE.
Yes,
we are
absolutely.
all
let's
working hard to try to
I'm
fix
sure you
those
are, but
gaps.
let's talk about it here, because the NHS gets through 150,000 gowns, for instance, every single day, which by a process of mathematics means 1 million gowns a week. How many gowns are we sending them a week?
Yeah, well, when I look at the total figures, I don't know the exact figure on gowns, so let me say.
Well,
when I look at the exact figures per day, it's not unusual that we are delivering 12 to 15 million items a day, many of which are gowns.
Items are all sorts of things, but I'm just sticking with gowns. Is it possible? I know there's a press conference later on today to get that figure, because it's a very important way of measuring how the government is doing.
Oh yes, these numbers are available every single day for.
So you can get to the gowns figure later on.
At the 5 o'clock or 4 o'clock, whatever time the press conference is this afternoon, I know that when I've done the number 10 press conference, I have all of that data. It's collected every day. We're being completely open with it, and as I say, millions of pieces of PPE are being delivered every single day, and the army and the whole infrastructure of government and many volunteers are helping with this.
Before this all started, not one single gown was being stockpiled by this country. That was a bad mistake, wasn't it?
Well, I think there are many lessons that can be learned. What's interesting is when we look at this idea of a pandemic, which has been for many years a sort of high on the risk register, the sort of pandemic that most people were thinking of was an influenza pandemic of the regular type. But this clearly has taken the world by storm in a completely different way to anything that people imagined for 100 years. So since the Spanish flu. So again, let's have full and proper look at all of these things.
We've talked endlessly about testing, but testing doesn't really mean anything unless you then track and trace people. So the government has said that you are going to recruit and train 18,000 people to track and trace. How many have we recruited so far?
I don't have a number for the number so far, but what I can tell you is we will have 18,000 by the time this is released. What I don't want to do, what I was going to say, Andrew,
I'm not going to get into a race about it.
Yeah, what I don't want to do is get into another 100,000 tests being done. That's all we did it in the end. We'll do it with 18,000 people being trained. It's not a complicated thing to train for. It doesn't take a very long time to do. The important thing is that the app, which is going into testing this week, into live testing this week, that is rolled out and that people download it, and that will help with a lot of the automation, the tracking of who's got it.
The more important thing perhaps is 18,000 anything like enough? Because a lot of people who specialise in this area say it's a drop in the ocean. It's much, much more. You're going to 100,000 people we're going to need.
Yeah.
Are you going to carry on recruiting people beyond the 18,000 so we have enough to track and trace everybody?
So the 18,000 is the initial plan, and the reason why we think that might be the right number, though it's actually, as I say, relatively straightforward to recruit and train people in this particular activity, apart from the 3,000 medically trained people who are already involved in this, is the software. And this app, which I just want to go back to, we will be asking the whole country, where possible, to download this mobile phone app, which will help automatically to remove the need for individuals to be involved, because that will say, if you and I have it and we are within Bluetooth range of each other, and I'm later tested and I'm positive, it will alert you. So that removes the need to have a person in between there. So
and you're absolutely sure we're going to have enough tracker and tracer people trained up in time for this?
Just as we've done. In terms of the 18,000, absolutely. As I say, it's not a ridiculous ask at all. And one thing I'd say is, you see the way that this country and the population has come forward to volunteer and be involved in the national effort, the 750,000 people who volunteered in the first place. It is incredible. So there is clearly a pool of people who'd be very happy to help in any way that they can, but the 18,000 specifically, absolutely, we'll have them ready when the app is ready.
It just seems to a lot of people as if we were not well prepared for this. You talked about gowns and the flu pandemic, flu possibilities, but the government's own advisors said we should be stockpiling gowns, and the government decided not to. And that does, again, I seem to be a pretty serious mistake.
Well, look, I disagree by comparison to what anybody thought was in the realms of likely possibility.
Well, so lots of people were talking about this kind of pandemic in the past. The scientists have been for a long time.
The government advice, and I've been in government over a period of time, and the one thing I know is that we are a very scientifically led administration, particularly this one. And if the scientists say you should be doing this, as we've seen throughout this pandemic and our response to it, that is the response that we take.
But
it's
you
not
say,
always,
I'm sorry to jump in.
It's not always quite as clear cut as you're suggesting,
well,
because what people would have been preparing for is the flu, not for COVID-19.
All I'm asking you, ministers always say we follow the scientific advice, but in this case, the advice was stockpile gowns, and ministers decided not to. Why not?
I don't know where you're getting that specific detail from, but I'm not aware of that particular advice. I never saw it myself. But and there certainly were stockpiles of certain materials. But, again, let's be completely open, completely transparent with it, and let's see what lessons the country learns for the future, even if these are a 1 in 100 year occurrences.
Let's move to your own area, transport. Are we going to quarantine people for 14 days or whatever when they come into this country?
Well, I do think that up until now, of course, the numbers coming in are very small and largely the Brits returning, British nationals who were abroad. About 3 million people ordinarily in March would travel on holiday and elsewhere. So there were a lot of people to get back to the country, and then, of course, they joined the lockdown. I think it is important.
Are we going to do it or not?
I was going to say, I think it's important, as we're seeing the numbers decrease and the R rate, we hope, decrease, and we'll have more advice on that later in the week, that we do ensure that the sacrifices, in a sense, social distancing, that we're asking the British people to make are matched by anybody who comes to this country. So I am actively looking at these issues right now, so that when we have infection rates within the country under control, we're not importing.
So this is a difficult call for you, because I know the airline industry is very worried about 14-day quarantine. On the other hand, the French have done it. And at the beginning of all of this, right at the start of the epidemic, 100 other countries introduced quarantines or other measures, but Britain did not. Why not?
Well, for a start, we have millions of people who were abroad and needed to return home. Secondly, it's not quite as clear-cut as your question suggests. America, for example, banned flights from Britain and Europe and have experienced many deaths. So it's not actually a clear, that wasn't a clear point at which it may have been an advantage. And the scientific advice, and to answer your question directly, the medical and scientific advice at the time was that's not going to make a sufficient difference. However, the scientific and medical advice coming out of it, when you've got the infection rate under control domestically, may well be very different. And that is why this is a serious point under consideration.
I just don't understand this with respect, which is, how can it be, if people have got COVID-19 and are travelling around the world, including into Britain, it was wrong not to stop them, do temperature checks, health checks, possibly even quarantining people to prevent this coming in. People, it's a common sense point. If people have got it and they're coming to Britain, why are we not stopping them and quarantining them?
So it's actually a question I directly asked the Chief Medical Officer right at the beginning of this, when indeed before the lockdown we were still meeting in person. And the answer was quite simply, when they looked at the science, what they found was, although you might, by having a complete lockdown of the borders, whilst you might delay it for 3, 4, 5 days, it would still find its way in, and you'd be in exactly the same problem, and created a new problem, which is...
It would have given us 5 days.
No, it would have prevented a lot of Brits from being able to return home and be with their families. That's actually what it would have done.
All right, let's turn to trains. Another very, very difficult problem is, if you're going to enforce social distancing by 2 metres or whatever in trains, then we heard earlier on, you're going to have to cut the number of people in a train to something like 12% of the norm, which means the vast majority of commuters around the country will not be able to get to work by train. How are you thinking about doing this? How are you going to organise it?
Yeah, you're absolutely right about the scale of the problem here. Of course, about 95% of commuters aren't travelling at all now, because we've only got key workers. the first thing is, obviously, we'll expand the number of trains and buses running. The second thing to say is active travel, I think, is a very important part of this, by which I mean cycling, walking, and so on. And so we've seen a massive expansion.
But if you're 30 miles away from work, you can't walk there. So will you, for instance, be distancing people who are queuing at bus stops, or distancing people queuing outside train stations and on platforms, and then limiting the number of people who can get onto a train, possibly by forward booking?
So I'm looking at the train, working with the train companies, unions and the rest of them, all of the above, and there are a series of different things that we can do, including, for example, staggering work times, working with business and organisations to do that. But I just want to make the point about bikes. You're right, not everyone will be able to cycle. I totally accept that. There's been a massive increase. I've been looking at the figures. Hundreds of % more people using an existing scheme where you can go to your employer and ask for a bike through that, which you pay back through the loan and effectively before you pay tax. Now, that's a very popular scheme, and I think active transport, active mobility.
Let me ask you about,
do a lot more of.
One other area where you certainly can't cycle, which is flying abroad on the family holiday. You've said you're not going to book a holiday this year. Do you think, in practical terms, this world in which most people felt they had some kind of right to get on a plane and go abroad for their holiday is coming to an end?
Yes, I haven't said I wouldn't book a holiday this year, only that I wouldn't book one yet, and I can't, in fact, because, of course, domestically, we can't travel around, and internationally, the Foreign Commonwealth Office has said we shouldn't be travelling, and indeed, most countries won't allow you to fly in. So that's just a fact of life at the moment. It's clearly going to take some time, and particularly for aviation, of all industries, to come out of this. We'll support and help where we can, but I do think we have to be realistic about what the shape of that will look like.
Grant Shapps, thanks very much indeed for talking to us today. That's all from me. Thanks for watching, and thanks to all my guests. More politics straight after this on BBC One. But until next week, from me, goodbye.